Hey everyone, and welcome. Today, we're diving into a topic that touches millions of lives, but is so often misunderstood. We're going to talk about addiction, but maybe in a new light, not as a choice or weakness, but as a medical condition that has a clear path to treatment. So let's start with the big question, the one at the center of it all. Is addiction a choice, or is it a disease? How you answer that one question really changes everything: how we talk about it, how we treat it, and even how we feel about it. And this quote just nails the perspective we're exploring today. Addiction is a medical condition, not a personal weakness. This single idea is a total game changer, moving us away from blame and toward real understanding. It's the foundation for everything we're about to cover. Okay, so let's dig into this first big idea: addiction as a disease, not a choice. Why does this distinction matter so much? Well, because when you see it as a disease, you can study it. You can figure out what's happening in the body and brain and develop treatments that actually work. It allows people to ask for help, just like they would for diabetes or asthma, without all the stigma. So to really get it, we've got to look under the hood, right? What is actually going on inside the brain that makes addiction so powerful? Let's start with the official definition to understand how it takes hold. The key phrase here is the brain's reward system. See, addiction isn't about character, it's about brain chemistry. Certain substances can hijack this system. They flood the brain with pleasure chemicals like dopamine. And over time, the brain starts to depend on that flood. That's what leads to those intense cravings and the feeling of losing control. And it's exactly why someone can't just decide to quit. It's a biological battle. And this condition isn't limited to just one thing. It can involve alcohol, which is everywhere in our society. It can happen with prescription drugs, like painkillers that were initially prescribed by a doctor. And, of course, it can involve illicit drugs. The substance might be different, but the medical condition happening in the brain is fundamentally the same. So, knowing all that, how do you know when it's time to get help? For yourself, or maybe for someone you love? Recognizing the signs is always the first, most critical step. Let's walk through what those look like. The first big sign is a loss of control. This is when someone genuinely wants to stop, or even just cut back, but they just can't. No matter how many times they try, the cravings are so powerful that they end up taking over. Then there's withdrawal. This is what happens when the substance is taken away and the body and mind basically protest. We're talking about things like shaking, sweating, or crushing anxiety. These are unmistakable signs that the body has become physically dependent. You know, it's funny. You might hear someone brag that they can handle a lot of a substance. But what that often is a sign of increasing tolerance. It means their body has adapted and now needs more and more just to get the same feeling. It's not a sign of strength. It's a huge indicator that dependence is getting deeper. Here's another major red flag: when life starts taking a backseat. When using a substance becomes more important than work or school or even relationships with the people who matter most. Responsibilities start to slide because the priority has shifted. And finally, there's continuing to use even when it's causing obvious harm. This could be physical health issues or serious mental health problems. It also includes taking dangerous risks while under the influence. The person knows there's a problem, but the compulsion to use is just too strong to stop. Okay, so we've talked about the signs, and I know that can feel pretty heavy. But here's the most important part. There is a path forward. There is hope. Professional treatment provides a real, structured roadmap to get from where you are to where you want to be. So what does that roadmap look like? Well, a really solid treatment plan is a whole process. It kicks off with a complete assessment to understand everything that's going on. Then there's often medically supported detox to manage withdrawal safely. The real work happens in therapy, sometimes paired with medication. It also has to address any other mental health conditions like anxiety or depression. And crucially, it brings the family into the process and sets up a plan for long-term support or aftercare. And I really need to stress this: there is no cookie-cutter solution here. A good treatment plan is always tailored to the individual person. The first goal is just to get things stable. After that, the focus shifts to building a strong foundation for a lasting recovery. Because that's what this is all about. Recovery isn't just about not using a substance anymore. It's about building a brand new life, one that's healthy and full. But of course, that journey comes with some very real fears and questions. Let's tackle one of the biggest ones head on. This is the question that's probably on your mind, right? It weighs on everyone who is thinking about or going through treatment. It's a fair question, and it deserves a straight answer. And the honest answer is yes, relapse can happen. But, and this is so important, it's not a failure. It's often just a part of the long, winding road of recovery. And that is exactly why that last step, aftercare, is so essential. It's the ongoing support system that helps you get back on track and massively reduces the risk over the long haul. And that brings us to the ultimate message, the real takeaway here. With the right help and support, anyone can get their life back. A diagnosis is not a life sentence. As the source material puts it so perfectly, addiction does not have to define the rest of your life. So, as we wrap up, I want to leave you with a final question to think about. What would it look like if we lived in a world where asking for help with addiction was met with the same compassion as asking for help with any other illness? A world without stigma. Just imagine that. Helping build that world is something every single one of us can be a part of.